Question 1. A nurse is assessing a patient in the emergency department who reports lower abdominal pain and vaginal bleeding. Which finding is most concerning for ectopic pregnancy? A. Bilateral breast tenderness. B. Pain relieved by lying down. C. Sharp unilateral pelvic pain. D. Irregular menstrual periods. Answer. C. Sharp unilateral pelvic pain. Question 2. A 28-year-old female presents with heavy vaginal bleeding after a spontaneous miscarriage. What is the nurse's priority action? A. Notify the chaplain. B. Prepare for dilation and curettage. C. Administer oxygen via nasal cannula. D. Monitor emotional response. Answer. B. Prepare for dilation and curettage. Question 3. Which task is appropriate to delegate to a licensed practical nurse, LPN, caring for a post-op hysterectomy patient? A. Initial assessment of abdominal incision. B. Educating the patient about discharge medications. C. Monitoring intake and output. D. Adjusting PCA pump settings. Answer. C. Monitoring intake and output. Question 4. A postmenopausal woman reports vaginal bleeding. What should the nurse anticipate as the most important next step? A. Suggest hormone replacement therapy. B. Schedule an endometrial biopsy. C. Reassure her this is normal. D. Perform a pap smear. Answer. B. Schedule an endometrial biopsy. Question 5. A nurse is caring for a patient with suspected pelvic inflammatory disease, PID. What assessment finding supports this diagnosis? A. Lower back pain and normal WBC count. B. Rigid abdomen and rebound tenderness. C. Cervical motion tenderness and fever. D. Dysuria without fever. Answer. C. Cervical motion tenderness and fever. Question 6. Which gynecologic condition is most associated with infertility in a patient with chronic pelvic pain and dyspareunia? A. Uterine fibroids. B. Endometriosis. C. Polycystic ovary syndrome PCOS. D. Cervicitis. Answer. B. Endometriosis. Question 7. A patient post-total abdominal hysterectomy reports sudden shortness of breath. What is the nurse's priority action? A. Assess incision site. B. Perform incentive spirometry. C. Notify the provider immediately. D. Reassure the patient. Answer. C. Notify the provider immediately. Question 8. Which patient should the nurse assess first after receiving shift report in a gynecology surgical unit? A. A patient 12 hours post-hysterectomy reporting 5/10 pain. B. A patient with history of endometriosis requesting PRN ibuprofen. C. A post-D and C patient with blood-soaked perineal pad in 1 hour. D. A patient post-myomectomy requesting ambulation assistance. Answer. C. A post-D and C patient with blood-soaked perineal pad in 1 hour. Question 9. A nurse is providing care to a patient with PCOS. Which is the most important nursing teaching? A. Increase protein intake. B. Monitor for signs of depression. C. Perform weight management and lifestyle changes. D. Avoid dairy products. Answer. C. Perform weight management and lifestyle changes. Question 10. Which of the following would be a red flag for ovarian cancer in a patient undergoing assessment? A. Cyclical breast tenderness. B. Sudden onset of heavy menses. C. Early satiety and abdominal bloating. D. Pelvic cramping with menstruation. Answer. C. Early satiety and abdominal bloating. Question 11. A nurse is caring for a patient receiving brachytherapy for cervical cancer. Which safety precaution is essential? A. Keep the patient NPO. B. Encourage frequent ambulation. C. Limit staff exposure to 30 minutes per shift. D. Place patient in prone position. Answer: C. Limit staff exposure to 30 minutes per shift. Question 12. Which action is appropriate for the RN to delegate to a UAP in caring for a patient recovering from laparoscopic ovarian cystectomy? A. Evaluate the surgical site for bleeding. B. Assist with ambulating to the restroom. C. Educate on signs of infection. D. Monitor for post-op nausea. Answer: B. Assist with ambulating to the restroom. Question 13. A patient reports new onset of pelvic pain and a palpable adnexal mass. What is the nurse's most appropriate action? A. Encourage hydration. B. Schedule routine gynecologic exam. C. Notify the provider for further evaluation. D. Provide NSAIDs and reassess in 24 hours. Answer: C. Notify the provider for further evaluation. Question 14. A nurse is caring for a patient undergoing colposcopy after an abnormal pap smear. What should the nurse emphasize during teaching? A. The procedure is performed under general anesthesia. B. Expect profuse vaginal bleeding post-procedure. C. Avoid intercourse for 24 to 48 hours after procedure. D. No need for follow-up unless symptoms recur. Answer: C. Avoid intercourse for 24 to 48 hours after procedure. Question 15. A 45-year-old woman is being evaluated for fibroids. What symptom most strongly suggests complications from uterine fibroids? A. Light menstrual periods. B. Bloating and fatigue. C. Heavy menstrual bleeding with clots. D. Occasional spotting between periods. Answer: C. Heavy menstrual bleeding with clots. Question 16. Which patient condition is most concerning following a vaginal hysterectomy? A. Voiding small amounts with mild discomfort. B. Scant pink vaginal discharge. C. Sharp pain with firm abdomen and tachycardia. D. Low-grade fever on post-op day 1. Answer: C. Sharp pain with firm abdomen and tachycardia. Question 17. A nurse is preparing a patient with cervical cancer for external beam radiation. What instruction is most important? A. Expect metallic taste after radiation. B. Apply ice packs to the treatment area. C. Avoid applying lotions or creams before treatment. D. Take antacids before each session. Answer: C. Avoid applying lotions or creams before treatment. Question 18. What is the most appropriate intervention for a patient with dysmenorrhea who wants non-pharmacologic relief? A. High-protein diet. B. Hot compress to lower abdomen. C. Use of oral contraceptives. D. Avoid exercise. Answer: B. Hot compress to lower abdomen. Question 19. A nurse is reviewing a patient's pap smear report showing atypical squamous cells. What is the next best nursing action? A. Schedule immediate biopsy. B. Notify the provider for further evaluation. C. Reassure the patient this is normal. D. Repeat pap in 3 years. Answer: B. Notify the provider for further evaluation. Question 20. A patient receiving chemotherapy for gynecologic cancer reports mouth sores. What is the most appropriate nursing intervention? A. Suggest spicy foods for stimulation. B. Encourage saltwater rinses. C. Use hydrogen peroxide mouthwash. D. Recommend alcohol-based rinses. Answer: B. Encourage saltwater rinses. Question 21. A patient with a history of polycystic ovary syndrome, PCOS, is concerned about irregular periods and facial hair. What nursing education is most appropriate? A. These symptoms are unrelated and likely coincidental. B. PCOS can lead to insulin resistance and hormonal imbalances. C. A hysterectomy may be necessary to resolve these issues. D. It's best to avoid exercise to reduce hormonal fluctuation. Answer: B. PCOS can lead to insulin resistance and hormonal imbalances. Question 22. A nurse is assessing a patient with endometriosis. Which symptom should prompt immediate provider notification? A. Mild dysmenorrhea. B. Nausea during menstruation. C. Sudden severe pelvic pain and dizziness. D. Bloating and fatigue. Answer: C. Sudden severe pelvic pain and dizziness. Question 23. Which task can a nurse safely delegate to an unlicensed assistive personnel, UAP, caring for a gynecologic surgical patient? A. Administering oral analgesics. B. Evaluating pain response. C. Assisting with perineal hygiene. D. Teaching perineal care. Answer: C. Assisting with perineal hygiene. Question 24. A nurse is caring for a patient who had a radical hysterectomy. Which finding requires priority follow-up? A. Urinary retention. B. Scant serosanguinous drainage. C. Mild constipation. D. Abdominal tenderness with movement. Answer: A. Urinary retention. Question 25. A nurse is preparing discharge teaching for a patient after cervical cryotherapy. Which statement indicates a need for further teaching? A. I will avoid using tampons until cleared. B. I may have a watery discharge for a few days. C. I can resume sexual activity tomorrow. D. I should report foul-smelling discharge. Answer: C. I can resume sexual activity tomorrow. Question 26. Which patient should the nurse see first in a gynecology outpatient clinic? A. A patient with known fibroids and pelvic discomfort. B. A postmenopausal woman with new vaginal bleeding. C. A patient with PMS seeking dietary advice. D. A patient with mild vaginal discharge and itching. Answer: B. A postmenopausal woman with new vaginal bleeding. Question 27. A nurse is caring for a patient receiving 4-magnesium sulfate for preterm labor. What is the most concerning finding? A. Warm sensation and flushing. B. Absent deep tendon reflexes. C. Mild drowsiness. D. Decreased fetal movement. Answer: B. Absent deep tendon reflexes. Question 28. A patient with suspected ovarian torsion reports acute pelvic pain and vomiting. What is the nurse's priority? A. Administer antiemetics. B. Notify the provider immediately. C. Reassess in 30 minutes. D. Provide discharge instructions. Answer: B. Notify the provider immediately. Question 29. A nurse is teaching a patient with recurrent yeast infections. Which statement indicates effective learning? A. I will increase my sugar intake for energy. B. I should wear tight-fitting synthetic underwear. C. I will use mild soap and keep the area dry. D. I should douche regularly to stay clean. Answer: C. I will use mild soap and keep the area dry. Question 30. A nurse receives a call from a patient reporting green, foul-smelling vaginal discharge. What is the most appropriate advice? A. This is normal during ovulation. B. Increase fluid intake and rest. C. Schedule an urgent appointment for evaluation. D. Use over-the-counter yeast cream. Answer: C. Schedule an urgent appointment for evaluation. Question 31. A nurse is counseling a teen diagnosed with primary dysmenorrhea. Which non-pharmacological intervention is most effective? A. Limiting water intake. B. Using heating pads to lower abdomen. C. Wearing tight clothing. D. Bed rest for 72 hours. Answer: B. Using heating pads to lower abdomen. Question 32. A nurse is reviewing lab results of a patient with amenorrhea. Which finding should be reported to the provider immediately? A. Slightly elevated prolactin level. B. Negative pregnancy test. C. high FSH level in a 20-year-old. D. Low normal TSH level. Answer: C. High FSH level in a 20-year-old. Question 33. A patient receiving chemotherapy for gynecologic cancer is neutropenic. Which instruction is most important? A. Eat fresh fruits and vegetables. B. Avoid crowded places and wear a mask. C. Use herbal supplements for fatigue. D. Take acetaminophen for every fever. Answer: B. Avoid crowded places and wear a mask. Question 34. A nurse caring for a patient with HPV, human papillomavirus, should emphasize which teaching point? A. This condition requires long-term antibiotics. B. HPV increases the risk of cervical cancer. C. This is usually caused by poor hygiene. D. The virus is only transmitted through blood. Answer: B. HPV increases the risk of cervical cancer. Question 35. Which finding is most concerning in a patient with a known ovarian cyst? A. Intermittent pelvic pain during cycle. B. Palpable mass on exam. C. Sudden severe abdominal pain with tachycardia. D. Irregular menstrual bleeding. Answer: C. Sudden severe abdominal pain with tachycardia. Question 36. A nurse is reviewing discharge instructions with a patient following a loop electrosurgical excision procedure, LEP. Which instruction is most important? A. You can resume strenuous activity in 2 days. B. Avoid sexual intercourse for at least 3 weeks. C. Use tampons instead of pads. D. Douching is recommended to clean the cervix. Answer: B. Avoid sexual intercourse for at least 3 weeks. Question 37. A nurse is caring for a patient post-op from bilateral oophorectomy. Which symptoms should the nurse expect and plan for? A. Hyperthyroidism. B. Sudden onset of menopausal symptoms. C. Hypertension. D. Anemia and low platelets. Answer: B. Sudden onset of menopausal symptoms. Question 38. Which teaching should be included for a patient prescribed metronidazole for bacterial vaginosis? A. You may consume alcohol in moderation. B. Finish the medication even if symptoms resolve. C. Take with dairy to reduce nausea. D. Stop medication if urine turns dark. Answer: B. Finish the medication even if symptoms resolve. Question 39. A nurse is teaching a newly diagnosed patient with uterine prolapse. Which statement requires further teaching? A. I can use a vaginal pessary as prescribed. B. Pelvic floor exercises can help strengthen muscles. C. Heavy lifting may worsen my condition. D. Kegel exercises are ineffective for this issue. Answer: D. Kegel exercises are ineffective for this issue. Question 40. A nurse is prioritizing care in a gynecologic oncology unit. Which patient should be seen first? A. A patient reporting 7/10 abdominal pain after chemotherapy. B. A patient experiencing nausea after radiation. C. A neutropenic patient with oral temperature of 100.9 degrees Fahrenheit, 38.3 degrees Celsius. D. A patient asking questions about hair loss. Answer: C. A neutropenic patient with oral temperature of 100.9 degrees Fahrenheit, 38.3 degrees Celsius. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!